Sexual performance issues are among the most common concerns faced by men worldwide. Across all age groups, cultures, and lifestyles, millions of men experience challenges related to erections, ejaculation, or sexual confidence at some point in their lives. These concerns can affect not only physical intimacy but also emotional well-being, self-esteem, and relationships. Two of the most frequently discussed solutions for male sexual problems are Viagra and delay sprays. However, these products are often misunderstood, misused, and wrongly compared. Many men assume they work in the same way or treat the same condition, which is medically incorrect. This guide explains both options clearly, accurately, and scientifically from a urologist's perspective. To understand these treatments, it is important to first understand erectile dysfunction, commonly known as ED. Erectile dysfunction is defined as the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. Occasional erection problems can occur due to stress, fatigue, or temporary anxiety, but erectile dysfunction becomes a medical condition when the difficulty is consistent and ongoing. ED is frequently associated with poor blood flow to the penis, diabetes mellitus, hypertension, cardiovascular disease, smoking, obesity, lack of physical activity, psychological stress, anxiety, depression, and hormonal imbalances such as low testosterone levels. Because erections rely heavily on healthy blood vessels and nerve function, erectile dysfunction is often an early warning sign of broader health issues. One of the most commonly prescribed treatments for erectile dysfunction is Viagra. Viagra is the brand name of sildenafil citrate, a prescription medication belonging to a class of drugs called phosphodiesterase type 5 inhibitors, commonly abbreviated as PDE5 inhibitors. Viagra is used exclusively for the treatment of erectile dysfunction and is not intended to treat other sexual conditions. It has been extensively researched, clinically tested, and approved by medical authorities for use under proper medical supervision. Understanding how Viagra works helps prevent unrealistic expectations. During sexual stimulation, nerve endings in the penile tissue release nitric oxide. Viagra works by blocking the PDE5 enzyme, allowing cGMP to remain active for a longer period. As a result, blood flow to the penis improves, leading to stronger and more sustainable erections. It is important to note that Viagra does not cause spontaneous erections and does not increase sexual desire. Sexual stimulation is still required for the medication to work. Safe use of Viagra is essential. Viagra is usually prescribed in doses of 25 milligrams, 50 milligrams, or 100 milligrams, depending on the patient's age, medical history, and response to treatment. It should be taken approximately 30 to 60 minutes before sexual activity and works best when taken on an empty stomach. Consuming a heavy or fatty meal before taking Viagra can delay its effect. Only one dose should be taken within a 24-hour period. Viagra should not be used in combination with nitrate medications or certain heart drugs, as this combination can cause a dangerous drop in blood pressure. Medical consultation is necessary before use. Premature ejaculation, commonly referred to as PE, in some cases, ejaculation may occur even before penetration. Unlike erectile dysfunction, premature ejaculation is not related to blood flow problems. Instead, it is often associated with heightened penile sensitivity, altered nerve signaling, anxiety, psychological stress, learned sexual patterns, and sometimes hormonal or inflammatory factors. A man can have normal or strong erections and still experience premature ejaculation. Delay sprays are designed specifically to manage premature ejaculation, not erectile dysfunction. Delay sprays are topical products that are applied directly to the penis. Most delay sprays contain local anesthetic agents such as lidocaine or benzocaine. These substances are commonly used in medical practice to temporarily numb tissues and reduce sensation. Delay sprays work by temporarily numbing the sensory nerve endings in the glans penis, which is the most sensitive area. By reducing sensitivity, the ejaculatory reflex is delayed, allowing intercourse to last longer. However, delay sprays do not improve erection strength, blood circulation, or sexual desire. They also do not treat the underlying psychological or neurological causes of premature ejaculation. Typically, 1 to 3 sprays are applied to the glans penis approximately 10 to 15 minutes before intercourse. The spray should be allowed to absorb fully into the skin. Overuse of delay sprays can result in excessive numbness, reduced pleasure, difficulty maintaining an erection, or dissatisfaction for both partners. Comparing Viagra and delay sprays directly is a common misunderstanding. Viagra treats erectile dysfunction by improving blood flow and enhancing erection quality. Delay sprays treat premature ejaculation by reducing penile sensitivity. They address different medical problems and work through entirely different mechanisms. They are not substitutes for one another, and using the wrong product for the wrong condition often leads to poor results and frustration. In selected patients who suffer from both erectile dysfunction and premature ejaculation, a urologist may recommend combined therapy. This can involve the use of a PDE5 inhibitor such as Viagra along with topical treatments, behavioral techniques, or additional medications. However, self-medication or excessive use without medical guidance can worsen sexual performance and increase the risk of side effects. Medical advice should be sought if symptoms are severe. Correct therapy, healthy lifestyle changes, stress management, and psychological support provide the best long-term outcomes. Seeking professional medical care ensures both safety and effectiveness. References: American Urological Association AUA, Erectile Dysfunction Guidelines, European Association of Urology EAU, Sexual and Reproductive Health Guidelines, U.S. Food and Drug Administration FDA, Drug Label, sildenafil citrate, National Institutes of Health NIH, Erectile Dysfunction Overview, Premature Ejaculation Pathophysiology Journal of Sexual Medicine, McMahon CG, Premature Ejaculation Treatment, BJU International, Harvard Health Publishing, Sexual Health. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.